Uterine anomalies. This first one is uterine didelphius. This is subarcuate uterus, or you can also call arcuate uterus. This is septate uterus. The bicornuate uterus. These two are unicornuate. Here you can see a communicating type, that is one cornu is there, it is reduced in size but it's communicating. Here it is complete absence on one side, it is non-communicating type. These are unicornuate, it's bicornuate. To understand the anomalies in detail, first we will briefly go through the development of the uterus. Then we will understand the anomalies better. So it may appear complicated, but it is easy. So this, by the side of mesonephric duct, we have these brown colored tubes here called as paramesonephric ducts. These paramesonephric ducts or the Mullerian ducts give rise to the female genital duct system. Paramesonephric duct is also called as Mullerian duct. So initially the paramesonephric duct are laterally oriented to mesonephric, therefore they are called paramesonephric. After the formation of the urorectal septum in the lower portion, the paramesonephric duct will cross from lateral to medial to end on the medialmost aspect. So when it is end on the medialmost aspect, it will unite with the opposite paramesonephric duct to form uterovaginal canal. So I will tell you, initially paramesonephric duct is lateral to mesonephric duct. Later the lower part will cross over the mesonephric duct and reach the midline. When it reaches midline, it unites with the opposite partner to form uterovaginal canal. So the upper vertical portion of the paramesonephric duct becomes the fallopian tube, whereas the lower vertical portion unites with the opposite lower vertical portion of the Mullerian duct or the paramesonephric duct to form uterovaginal canal. When you know that uterovaginal canal is formed, so obviously the upper part of the uterovaginal canal will give rise to uterus, the lower part of uterovaginal canal will give rise to vagina. Whereas the fundus of the uterus is formed by the middle horizontal portion of the paramesonephric duct or Mullerian duct. So upper vertical portion of the Mullerian duct give rise to fallopian tubes, which will not unite, no, that one. The middle horizontal portion will give rise to the fundus of the uterus. The lower portion of the Mullerian ducts will unite with one another to form uterovaginal canal. Obviously, the upper portion of the uterovaginal canal give rise to uterus, lower portion give rise to vagina. When they unite, there will be one common wall, okay, when the two tubes are uniting. This common wall will undergo apoptosis, that is, it will disappear. It's a programmed cell death. When it disappears, the uterus will have a single cavity, that is triangular in outline in coronal section. It is called the uterine cavity. So let's understand the anomaly now. Why the embryological basis of each of this. Another 2 minutes it will be over, so please listen carefully. So this is called uterine didelphius. So why it's called like this? We can see the entire paramesonephric duct or the Mullerian duct of both sides are not united. So there is a separate fallopian tube, separate uterine cavity, separate vagina. Here also, on the left side also, separate fallopian tube, separate uterine cavity and separate vagina. This condition is called uterine didelphius, meaning to say there are two separate uterus. In such condition, forensic importance is that one of the uterus can bear the one child, one conception, whereas other uterus can undergo menstrual cycle in the initial phase. Subsequently, due to HCG, the menstrual cycle will stop in both the uterus, but both the childs can be of different gestational age. That is possibility, because if there is polyovulation due to drug induced So that time one child can be conceived, for example, in January, whereas the other child can be conceived in February. Okay, so month difference can be there in this uterine didelphius. Moving on to this arcuate uterus or subarcuate uterus. Here we can see the upper portion has given rise to fallopian tube, lower portion uterovaginal canal. But you see this middle horizontal portion, it is not united properly. So instead of a convexity present on the upper part of the uterus, there is a dip, that is called arcuate, subarcuate or arcuate uterus. If you consider this is like an arc one side. Okay, if you consider the middle, it is subarcuate. So based on that, few authors tell arcuate uterus, few authors tell subarcuate uterus. No problem. Then the next anomaly is septate uterus. What is the septate uterus? I told you the lower portion of the Mullerian ducts have to unite with one another, and the common wall within the uterus should disappear. If it does not disappear, if it persists throughout, it is called as septate uterus. This is a complete septa. It can be just half present, then we call it as incomplete septa. Just near the fundus it can be present. The common wall failed to undergo apoptosis or programmed cell death. It results in septate uterus. So this condition has to be treated. Otherwise, after conception, the septa will interfere with the growth of the fetus because there is no adequate uterine cavity. All these require treatment actually. Then we'll move on to the bicornuate uterus. So what is this bicornuate uterus? See, cornu is a Latin word, C-R-O-N-U. It's a Latin word which means horn. Okay, imagine the uterus, or imagine any animal having two horns. Don't you think this uterus is resembling two horns of an animal? That's why it is called as bicornuate uterus. The problem here is the upper part has given rise to fallopian tube, no problem. The lower vertical part has united to form uterovaginal canal, but here the union is not complete. The vagina and the common wall within the vagina, the lower part has disappeared. But you can see the upper portion of this uterovaginal canal has not completely united. So this is called as a bicornuate uterus. This is called as unicornuate uterus, but the problem here is one of the paramesonephric duct or Mullerian duct is well developed. You can see the fallopian tubes, the uterus, it's all of normal size. Whereas the other side, the left side, the paramesonephric duct or Mullerian duct, it is redundant or decreased in size. So it appears like this person has got only one horn on one side. Right side horn is developed, left side it is not developed. So it is degenerated. So, or disintegrated we can call. This is called as unicornuate uterus. Uni means one side, corn means only one horn is developed, whereas the other horn is redundant. So it has got a cavity still. It's called communicating type of unicornuate uterus. We can see the cavity of this redundant horn is still communicating with the main uterine cavity. So that if ovulation occurs in this ovary, still the ova can reach the destination, that is the uterus. Okay, and this is complete agenesis of one side. Paramesonephric duct of left side has disappeared. Here there is a smaller vagina, smaller uterine cavity, and only one fallopian tube. Okay, this is a complete agenesis of one side, Mullerian duct or paramesonephric duct. This also resembles a unicornuate uterus, but there is no other side, corn is not even there. Okay, it's completely disappeared. So you can call it as complete agenesis. So to summarize, we have uterine didelphius, where two paramesonephric duct are completely failed to fuse with one another. So the person has two fallopian tubes, two uterus, two vagina. This is called a subarcuate uterus, where the middle horizontal portion of the paramesonephric duct failed to grow properly. So there's a dip in the superior portion near the fundus of the uterus. It's called septate uterus. After the union of the lower vertical portion of the paramesonephric ducts, the common wall should disappear, but here it has not disappeared, leaving the septa. Here we can see the complete septa. There can be partial septas also. Okay, that is septate uterus. This is bicornuate uterus, where the uterus resembles two horns are there in the uterus. Bicornuate uterus. This is unicornuate uterus, where only one horn is there, other horn or the corn is reduced in size. That is called unicornuate uterus. It's a communicating type. There is a complete agenesis of one side of the Mullerian duct or paramesonephric duct. This is also unicornuate uterus with absence on the other side. Thank you for watching and learning from Logic Medico. If you like this video and get some knowledge, kindly press the thumbs up icon, subscribe to our channel, and don't forget to share this video with your other friends. Thank you.